Good day, everybody. It is a wonderful time of the year. Leaves are changing, so fall clearly here. I always know when it's time for season because the weather channel is covering snowstorms and precipitating snow in the western and mountainous parts of the country. That's fine, but it's always a reminder of how beautiful this time of the year can be. And that we need to prep for our next level of stuff that's coming at us in fire EMS. So, of course, this morning, there was the first carbon monoxide call. And we had a detector going off, and it turned out to be a real one. And so not even with somebody's heating system kicking on, but it was another leak that caused carbon monoxide. So a retooling of your mind occurs about this time of the year when we begin to think about carbon monoxide and as a source of people down or people ill or multiple people ill, even in the face of infectious diseases. Carbon monoxide is still something that we clearly save people's lives in regard to. And it's not just about finding the primary person that is ill, but all of the others who may be at risk. And this year, with social distancing and other things that are going on, and people closer to their homes, and very frankly, cars that are a lot quieter than they used to be, and not so obvious that they're running, but still, it's beginning of the season when people are turning on their heating systems. And over the summer, the vent was blocked by birds or bees' nests, or whatever happens to be. So don't forget carbon monoxide as we move into this time of the year. Another piece of problems that we run into this time of the year is influenza and respiratory viruses. So we begin to talk about flu, but it's our opportunity this week to make sure we focus on what flu is and what we can do to prevent it. We proved last year that we can smash influenza down to near zero levels. We reduced the spread of COVID with things like staying at home, washing your hands, using social distancing, and putting masks on. But we completely obliterated influenza. There were a handful of deaths reported from influenza after the beginning of COVID restrictions last year. The last 2 years, we've had the last two flu years, we had kind of a persistent strain of influenza A that was going around named H3N2. And it was rolling through the country in 2019 into 2020. So think December, January, February into March when we began to run into COVID. And then all influenza went straight downhill. In the Southern Hemisphere, over the past 5 months, they've had very little influenza, but we worry that at any point, the influenza could kick up in this country. There are already a few states where flu is beginning to spread. It is spreading, and we know about it because people who get respiratory symptoms are getting a swab in their nose or they're spitting in a cup, and they're testing it not only for coronavirus, but also for influenza. And a little early, frankly, this year, September, we were beginning to pick up influenza across the country. So what can you do about it? Well, number one, you can consider the influenza vaccination. Single shot this year, it has 4 strains in it. 2 of them are A strains, 2 of them are B strains. One of the A strains is that H3N2, which has been a problem over our preceding years and was still circulating in this country and across the globe. Influenza is a single dose this year for people below age 65 and a higher dose for those of you above the age of 65. And once again, it is safe, and we think it will be effective for the strains that are circulating this year. What we want to do is make sure that as we come out of COVID times and move into other respiratory disease times, influenza does not become a big killer again of both adults and children, which it has in the past. COVID has been our prime concern, but what it did to change behaviors really influenced a lot of other respiratory diseases. So that, again, staying at home when you're sick, always a good idea. We are, as an industry, probably the worst. And people have full expectations that unless you are very, very ill, you're going to appear at work. And last year that became not the thing to do. And people actively kicked you back out the door if you came to work ill and were coughing or sneezing or throwing up or had a big rash or had some other symptoms that you were ill. People did not want you around in the fire EMS stations and sent you home. That's probably a good long-term behavior we need to learn from, because that certainly stopped the spread of a lot of infectious illnesses. Number 2, washing your hands. Always a good idea, and still is a good idea, mostly for diseases that affect your GI tract. And of course, nothing to ruin the day of a fire and EMS person, like having to visit the John frequently, either throwing up or having diarrhea. And then it interferes with your calls. And then you're out on a call and have to ask somebody if you can use their bathroom, et cetera. That's an unpleasant way to spend your shift and to ruin a perfectly good incident. All right, number 3 is get an influenza vaccine. So this year, good mix. They're available. And this year, they have said if you are going to get your coronavirus vaccine or a coronavirus vaccine third dose, that you can get them both at the same time, but they'll give them to you in separate arms. Social distancing, always good. It prevents the spread of essentially all diseases. And so always a good practice when we're dealing with patients, and then out in the public when appropriate. What's going to be very interesting this year is masks. And some personnel are going to say, I really felt comfortable last year wearing a mask and protecting myself from respiratory diseases. Remember that a mask protects you from some inhaled bugs, and it particularly protects other people from you exhaling your bugs. And so people wearing masks across society kind of became the thing to do, and no doubt was one of the steps that reduced influenza spread across the entire globe. There may be some of our people who are very comfortable over the winter continuing to wear masks, and that may be appropriate, and for their own health, they may feel that's the best thing to do. So masking, an option. Social distancing where appropriate, an option. Not coming to work sick really should be a mandatory practice. And then getting an influenza immunization, a recommendation that will come through in many agencies this year, and it's readily available. Wanted to talk a little bit more about COVID vaccinations this week because several approvals by an FDA advisory committee have come through. As yet, none of those are finalized yet. And after this committee has approved them over the last couple of weeks, they have to go through a CDC committee, and they have to go through the CDC formal process and the FDA formal process. At the end of it, I want to assure you that we will prepare a set of recommendations. Those recommendations will be a little different based on whether you got the Pfizer, the Moderna, or the Johnson & Johnson vaccine or vaccine series already. Those recommendations may change a little bit over the next couple of weeks. So science keeps evolving. And in particular, one of the controversial areas right now is the second injection after you got a first J&J, Johnson & Johnson vaccine. We don't know what the final advice will be, but it very well could be that you should get a second Johnson & Johnson, or your second vaccine would be either Moderna or Pfizer. And we're not sure of the dosing because the Moderna has the potential that it would be at a different dose. So be prepared, and we'll discuss that over the coming weeks in DocTalk. Whatever that schedule is, I want to remind you, we have done these immunizations before. A very strong practice in our industry has been hepatitis B. Hepatitis B has had 2 forms of it. One form that is a 2-injection series given about a month apart. Another that is a 3-injection form, giving it 0, 1 or 2 months, and 6 months apart. to protect people in our industry, which has a very big danger for hepatitis B, to protect our members. And it has been very successful in protecting our members. A scourge in the industry when I started in it a long time ago was hepatitis B, and what killed some of our members and retirees, hepatitis B. That has been essentially eradicated. And thank you all for working with that. That gives us the basis for what we're doing now with the double injection for COVID, or with the 3 injection series that we may have for some of our vaccines. So it's October, moving into fall, thinking about things that are fall related. We're halfway through our fire prevention, burn prevention month, breast cancer month, and that's an important part of October as well. You all stay safe. DocTalk will be back in a week. We'll have more information on the vaccines and more to talk about in terms of preventing illness in your fire station and in your home. Thanks all.